If you have an enlarged prostate, also known as benign prostatic hyperplasia, BPH, you're likely aware of the discomfort it can cause. Frequent urination, especially at night, an urgent need to use the bathroom, and a persistent feeling that your bladder isn't completely empty can make daily life challenging. In some cases, BPH can also cause pain during urination or ejaculation, further disrupting your quality of life. While the exact causes of an enlarged prostate are not fully understood, research suggests that certain lifestyle factors, including diet, can influence its development and progression. In this video, we'll explore which foods you should avoid to help manage or reduce your risk of developing an enlarged prostate. Before we begin, please take a moment to like this video and subscribe to our channel to help us reach more people. Don't forget to hit the notification bell so you're the first to know when our new videos are released. Let's get started. 8. Fried foods. Fried foods are often high in saturated fats and trans fatty acids, TFAs, both of which can contribute to inflammation in the body. Inflammation is a key factor in the development and progression of BPH. Consuming foods that are fried, such as French fries, fried chicken, and donuts, can lead to an increased intake of harmful fats, which may exacerbate prostate issues. Saturated fats are commonly found in animal products like meat and dairy, as well as processed foods. High levels of saturated fat can lead to an increase in inflammation, which may worsen symptoms of BPH and other health conditions such as heart disease and stroke. Additionally, TFAs, which are often found in commercially prepared fried foods, can raise bad cholesterol levels while lowering good cholesterol, further impacting cardiovascular and prostate health. To improve your overall health and reduce your risk of BPH, it's beneficial to limit your consumption of fried foods. Instead, focus on incorporating more fruits, vegetables, whole grains, and sources of healthy fats such as nuts, seeds, and avocados into your diet. These foods are rich in essential nutrients that can help manage inflammation and support overall health. 7. Dairy products. Dairy products are another category of foods that may negatively impact prostate health. Many dairy products, such as whole milk, cheese, butter, and cream, are high in animal-based saturated fats and hormones. These components can contribute to inflammation and potentially increase the risk of developing or worsening BPH. Research has shown that high calcium intake, often from dairy sources, may be linked to an increased risk of BPH symptoms. This association is particularly noted in individuals with low vitamin D levels. Some studies suggest that higher levels of saturated fat found in full-fat dairy products may be associated with an elevated risk of prostate cancer as well. Dairy products contain natural growth hormones, such as prolactin and insulin-like growth factor 1, IGF-1. Prolactin is involved in milk production and regulation of various bodily functions, while IGF-1 plays a role in growth and development. Elevated levels of IGF-1 have been linked to an increased risk of several cancers, including prostate cancer. If you have an enlarged prostate or are at risk for BPH, it may be beneficial to reduce your consumption of dairy products. You might consider replacing dairy with plant-based alternatives such as almond milk, soy milk, or coconut milk. Additionally, incorporating foods rich in calcium and vitamin D from non-dairy sources, such as leafy greens and fortified cereals, can help meet your nutritional needs without exacerbating prostate issues. 6. Refined sugars and grains. Refined sugars and grains can negatively impact prostate health by causing rapid spikes in insulin levels. Excessive sugar intake leads to higher insulin production, which can increase inflammation throughout the body. This inflammation can contribute to the development and progression of BPH. High glycemic load, HGL, diets, which include foods that cause a rapid rise in blood sugar levels, are often rich in refined sugars and grains. Examples of high glycemic index foods include white bread, sugary cereals, pasta, soda, and processed snacks. Consuming these foods regularly can lead to insulin resistance, which is associated with various health problems, including BPH. Refined sugars and grains often lack essential nutrients and fiber, which are important for maintaining a healthy weight and supporting overall health. Excessive intake of these foods can contribute to weight gain, which places additional strain on the bladder and can exacerbate urinary symptoms associated with BPH. To promote better prostate health, aim to reduce your intake of refined sugars and grains. Instead, focus on incorporating whole grains, such as brown rice, quinoa, and oats, as well as a variety of fruits and vegetables into your diet. These foods provide essential nutrients and fiber that can help manage inflammation and support healthy digestion. 5. Red meat. Consuming large amounts of red meat, such as beef and pork, can increase the risk of developing an enlarged prostate. Red meat is often high in saturated fat and cholesterol, which can contribute to inflammation and other health issues. Studies have found that higher consumption of red meat is associated with an increased risk of BPH. Red meat also contains higher concentrations of hormones, such as androgens, which can stimulate prostate growth. Additionally, processed meats, such as bacon, sausages, and deli meats, have been linked to a higher risk of BPH and other health concerns. Research published by Harvard Medical School found that higher intakes of both red and processed meats are associated with an increased risk of developing BPH symptoms. Another study in the American Journal of Clinical Nutrition found that a diet high in red and processed meats was linked to a greater likelihood of BPH. To reduce your risk of BPH, consider cutting back on red meat and processed meats. Opt for healthier protein sources such as plant-based proteins, legumes, nuts, seeds, and lean poultry. These alternatives can provide essential nutrients while supporting overall health and reducing inflammation. 4. Alcohol. Excessive alcohol consumption can negatively impact prostate health in several ways. Alcohol has a diuretic effect, which means it increases urine production and can lead to dehydration. Dehydration can irritate the prostate and contribute to its enlargement. Additionally, alcohol can disrupt hormonal balance, particularly by increasing the conversion of testosterone into dihydrotestosterone, DHT. DHT is a hormone involved in prostate growth and can contribute to BPH. Research has also linked excessive alcohol intake to a higher risk of prostate cancer, which can sometimes coexist with BPH. Drinking alcohol in moderation, or ideally avoiding it, can help maintain better prostate health and reduce the risk of complications. If you have BPH or are concerned about prostate health, it's best to limit your alcohol intake. Consider substituting alcoholic beverages with non-alcoholic options, such as herbal teas or water, to stay hydrated and support overall health. 3. Caffeine. Caffeine, commonly found in coffee, tea, and energy drinks, can have both positive and negative effects on prostate health. While moderate caffeine consumption may have some benefits, excessive intake can worsen BPH symptoms. Caffeine can stimulate the production of hormones that increase urine production, leading to frequent urination and bladder irritation. High levels of caffeine intake may also cause the smooth muscles in the prostate and bladder to contract, exacerbating difficulties with urination and other BPH-related symptoms. However, it's important to note that not all men with BPH experience aggravated symptoms from caffeine, and moderate use may potentially have a protective effect against BPH. 2. High-sodium foods. High-sodium foods do not directly cause BPH, but can exacerbate symptoms by increasing fluid retention and raising blood pressure. Excessive sodium intake can lead to swelling and fluid retention, which can put additional pressure on the bladder and worsen urinary symptoms associated with BPH. Processed and packaged foods, fast food, and restaurant meals are often high in sodium. Common sources include canned soups, frozen dinners, salty snacks, and condiments such as ketchup and soy sauce. Even baked goods like pizza dough can contain high levels of sodium. 1. Vegetable oils or seed oils. Vegetable oils, such as soybean oil, corn oil, and canola oil, are high in omega-6 fatty acids. While omega-6 fatty acids are essential for health, an imbalance between omega-6 and omega-3 fatty acids can contribute to inflammation. Excessive intake of omega-6 fatty acids from vegetable oils may lead to increased inflammation and exacerbate symptoms of BPH. In contrast, omega-3 fatty acids found in foods like fatty fish, flax seeds, and walnuts have anti-inflammatory properties that can support prostate health. Balancing your intake of omega-6 and omega-3 fatty acids is crucial for managing inflammation and promoting overall health. Instead of using vegetable oils in cooking, consider using healthier alternatives such as extra virgin olive oil, avocado oil, or coconut oil. These options provide beneficial fats that can support prostate health and reduce inflammation. Including omega-3 rich foods in your diet can further help to balance your fatty acid intake and support prostate health. In addition to dietary changes, maintaining a healthy lifestyle that includes regular physical activity, adequate hydration, and stress management is essential for managing BPH symptoms. It's important to consult with a healthcare professional to tailor dietary recommendations and treatment plans to your individual needs. If you found this video informative and helpful, please give it a thumbs up and subscribe to Healthy Natural Remedies for more content on health and wellness. Share your thoughts and experiences in the comments section below, and let us know if there are other topics you'd like us to cover. Thank you for watching, and here's to a healthy and happy day.